Today's guest is Ryan Bourne, who occupies the R. Evan Schaff Chair for the Public Understanding of Economics at the Cato Institute in Washington, D.C. Now, prior to his move across the pond, he was actually a fellow colleague of mine here at the IEA, serving as the head of public policy for us. And before this, he worked at the Centre for Policy Studies as their head of research. So he's got quite a bit of background with us and with the community over here in the UK before he moved over to Cato. He's written on a number of economic issues such as fiscal policy, inequality, minimum wages, infrastructure spending and rent control. He also has extensive broadcast and print media experience, but he's now taken the plunge into the world of authoring with his first solo book, Economics in One Virus, an introduction to economic reasoning through COVID-19. Ryan, thank you and welcome, and good to have you with us here on this book club meeting.
It's great to be with you, Steve, and I'd just like to commend the IEA for all the work that you're doing on COVID-19. I read Paul Ormerod's excellent paper recently that you published on the lack of economic thinking behind public health decisions. Some of the themes echo those in the book, and of course your own work on, especially manifesting itself through your Hayek lecture, trying to contextualize the crisis that we're living through and some of its implications have been really helpful. And of course, Chris Snowdon's work in debunking some of the worst myths of those skeptical that this disease is serious. So thank you for all the work that you do. Thanks for having me.
Oh, thanks for that. Well, I think the first thing I'd like to ask you is this really. It's striking that this book that you've written, which I saw an advanced copy of, it's not so much about the economics of the pandemic, although you do obviously talk about that. It's rather, as the title suggests, about how you can use this event, the pandemic, to show the continuing relevance and importance and also the nature of economic insights and arguments. So it's a way of actually introducing people to economics through the way the pandemic and our response to it reflects it and shows how important it is. So that's an interesting take, it seems to me. But let me sort of ask you, first of all, why does an extreme event such as a pandemic do this? Because surely a pandemic like this is by definition out of the ordinary. So why is this not a case where the rules of the game, if you like, the rules of economics are not suspended? Surely if it's extraordinary, you might argue that they are.
Well, that's a great question, Steve. And I agree with you in your characterization of the book. I think anybody looking to read this for a manifesto of what we should have done given the certain conditions that faced us back last spring through to today is likely to be somewhat disappointed. What the book really is about is introducing key economic principles, themes, and ideas through the case study of the pandemic. Now, from that, of course, there's an implicit criticism of some of the decisions that politicians and public health experts have taken, but it's quite a different approach to actually just trying to set out what optimal policy would be. Now, why is that relevant, as you say, in an age where the emergency situation means the ordinary rules of economic policy and the role of government, have completely changed as a result of this being a crisis? Well, I think events like this, emergency situations, are actually quite clarifying in many ways. As we go about our day-to-day business, or policymakers are making decisions about the role of government, quite often there's a lot of inertia and a lot of decisions that are taken are almost done on autopilot. It's sometimes only when you get an emergency situation that fundamentally changes the conditions in an economy that individuals have to think through from first principles, or rethink through from first principles, the actions that they want to take on a given day, or the policies that they want to implement given the conditions that face us. So I think moments like this can be incredibly clarifying. And when you're having to make decisions that have huge consequences, both for your health and the health of the public generally, and you're making them extremely quickly, it brings into focus a lot of those kind of economic ideas and principles that are necessary to adhere to make good decisions, right? Considering trade-offs, thinking about the behavioral response you might get from individuals, making sure that when you're assessing what the impact of a policy might be, you're thinking about it on the margin, i.e. you're defining the counterfactual of what would happen if you didn't make the decision well. So as I say, I think this is a clarifying moment, and actually the scale and consequence of the decisions being made actually highlights the need for economic thinking.
So, in other words, what you're saying is that it's precisely in an emergency situation, which might not just be this, it could be something like war, for example, as well. It's precisely in an emergency situation that clear, well-grounded economic thinking is particularly important, because you can't simply rely on, what has been done before as a kind of rule of thumb. You've got to actually understand the principles better. So that implies that in this emergency, really, good economic thinking is better than ever. Now, what particular principle do you think the importance has been highlighted during this particular emergency?
I'll just rewind a bit. And kind of discuss how this originally came about. So I was sat at home watching CNN, and there was a press conference with Andrew Cuomo, who's the governor of New York, and he was talking about the lockdown measures that were being instituted there last spring. And when he was asked a question on this, one of the immediate responses he gave was that typical politician take, which was, if these public health measures just save one life, then they'll have been worth it. Now, clearly, from an economic perspective, that was insane to suggest such a thing. We don't put completely unlimited value on saving any given life in our own lives, let alone from a public policy perspective. But I remember pulling out my notepad and kind of jotting down that I should write something about the value of a statistical life and how we value the benefits of health regulations in public policy. Later on that day, I went onto Twitter, and I saw a UK journalist talking about the individual health risks to people and different demographic groups as a result of this virus. And I noted down in my notepad, I should probably write something about externalities and collective action problems. I think the most important economic principle from this, and the one that has been badly applied at times, is actually the ability to think on the margin, the ability to think about the impact of a given policy or action on top of a counterfactual of what would have happened anyway. Had that not been instituted. And I think you see that most pertinently when you're talking about the costs and benefits of lockdowns. In fact, it's extraordinarily difficult to entirely convincingly ascertain the impacts of lockdowns, because underpinning our reaction to this pandemic has been an enormous change in people's behavior. Now, how much of that has come about because lockdowns have sort of been telegraphed and trailed over a long period of time, or how much of that would have happened anyway in the absence of lockdowns? I don't think any of us are sure. I think what we can say with some confidence is that lockdown measures and public health interventions do have an effect on the margin, but the precise scale of that is incredibly difficult. And you see this in a whole range of other debates as well. We could talk about the marginal benefit and the marginal cost of keeping people in travel quarantine for an extra day, for example. A lot of people have talked about COVID as if there are two options, kind of doing nothing or aiming for COVID zero, when in reality, from a public health perspective, we should be trying to get to the level of interventions where the marginal social benefit is equal to the marginal social cost.
Yeah, I agree completely. I mean, it does strike me that that's an area where many people seem to be very resistant to that particular economic insight, even though it's obvious they do it in their own life, because nobody aims for total perfection in anything and keeps on doing an extra bit of whatever it is they're doing just so they get it 100% right. And that's clearly not the alternative to doing absolutely nothing at all. So in their everyday life, they're doing it all the time. But it's something that simply isn't realized. I mean, if I could sort of like add to you, I mean, you've got several chapters, and each chapter looks at a particular economic principle and how it's raised and highlighted, or the importance of it is emphasized by the pandemic. One I'd like to sort of like raise with you is the whole question of trade and specialization, because one of the very common responses to this pandemic has been to say that it shows the weakness of a globally integrated economy, and that it shows that we need to have more domestic production, less international specialization, less international integration. And I'd said myself rather gloomily that I think probably the policy response that we're going to see in the aftermath is going to be that there will be a bit of a pullback from previous levels of globalization, as we call it. And that's not something I look forward to, but I fear it's something that will happen. So your argument, as I understand it, is that actually the pandemic reveals the opposite, that actually it shows the enormous importance and benefits of greater globalization, greater economic integration. So what would you say to that?
Well, I don't want to doubt your prognosis, Steve. I suspect that you're right. Disagreeing with you on issues like this tends to be a fool's errand. I would separate this into two different components, first of all. I think you're definitely right that one consequence of a crisis like this is that a lot of individual firms and suppliers and people sourcing inputs and materials, naturally, as a crisis hits, they'll begin to reassess how to make their individual company more resilient, and decide whether the disruption that they face now means that it's worth changing their suppliers or reshoring certain amounts of activity to avoid such dislocation again. Of course, in making that decision, they'll have to weigh off any near-term efficiency reductions against the potential to be more resilient in future. But that's part of an error correction process in a market economy. That's fine. What I think we're going to see, though, and what I think you're alluding to more strongly, is politicians attempt to go much further than the private sector would of its own accord, and actually use industrial policy and trade protectionism to try and reshore and repatriate vast amounts of both medical manufacturing and medicine production. Now, on the face of it, this argument, which is made by the likes of Marco Rubio over here, Robert Lighthizer, the former trade secretary under Donald Trump, and you're also beginning to see it permeate among conservatives in the UK. There was an interesting James Forsyth column a couple of weeks ago where he alluded to this shift in thinking among the UK Conservative Party. What you're beginning to see is that they believe that whilst free trade might deliver economic efficiency, and that's valuable, it actually undermines a country's resilience when a shock like this hits. Now, I would argue that is overwrought. There have been problems in regards countries imposing export controls, and we could perhaps talk about ways to circumvent the negative effects of that. But more broadly, I think there's a big problem with suggesting that repatriating or reshoring activity makes one more resilient. The first is you do give up an efficiency advantage, and efficiency in normal times is no secondary small fry matter. It's what makes us rich, and making us rich means that we can provide relief and actually try and deal with shocks when they do hit from a stronger base. The second point is that there's no guarantee that any future shocks will affect international supply and trade any more than they might affect domestic supply. During this pandemic, for example, to use a US example, there's been severe disruption at times to meat packing plants as a result of lots of people here contracting COVID-19. And the same has been true in the production of trucks and other vehicles. Now, at the time, there were severe production shortages as a result of that disruption. Had the US been in a position where it had more open trade in vehicles, they would have been able to import, and the German market would have been serving the US market, and we'd have been able to import trucks imported from Germany. We couldn't do that because there was no trade through that route, because for a long time, the US has imposed quite protectionist tariffs on the importation of trucks from the US. So if a future crisis hits the domestic economy and takes out a bunch of manufacturing capabilities because people are off sick, actually you end up less resilient than an economy with a big service sector where people are able to work from home. And this, I think, is the key point, right? I think the key point is if we really knew what the next crisis was going to look like, then there are more efficient ways of preparing for it. We could take the advantages of free trade and specialization and import and stockpile all the things that we thought that we needed. We could purchase options for certain things so that suppliers receive a premium income and keep some manufacturing capacity set aside to ramp up production should we need that production in future. Or we could sign more expansive free trade deals to diversify our options. Now, the problem is we don't really know what the next crisis is going to look like. And if you don't know what the next crisis is going to look like, then it seems to me a really costly bet to reorient much of your economy to preparing for a future pandemic that might look very, very different to this one.
Yes, indeed. I mean, we could well have another pandemic, but it might well be a different pathogen with a very different kind of spread pattern and things of that sort. So, and different effects in terms of its medical consequences. So, as you say, you really want something which is resilient, and the assumption is that somehow onshoring makes you more resilient. But I think, as I think you just said, that it could actually well work out exactly the opposite. You could actually increase fragility by putting too many of your eggs into particular baskets. Another thing which is you do talk about is regulatory trade-offs and where these come from. And it seems to me that there's a really interesting case in point here, obviously, with the successful production of several vaccines for dealing with the virus, the COVID-19 virus. Now, this has happened in, quite frankly, record time. It's extraordinary how quickly it's happened. And I must say, this is an area where I was delighted to be wrong, because I was very pessimistic about the prospects for getting a vaccine done, in less than a year. And in fact, it was done much more quickly than that. Now, the obvious question is, well, okay, is this because regulatory standards have been relaxed, or was it that they were too strict in the first place? And so that really does raise this point you have a whole chapter on, doesn't it, of regulatory trade-offs and how they work.
Yeah, I think that's right. And I think one of the big areas, a big opening for libertarians after this is on the medical regulatory side. The book is actually a kind of missed the boat a bit on the vaccination issue, because the vast majority of it had been written prior to the development and approval of the final vaccines, which, as we now know, at least for the variants of COVID that are out there, are high efficacy. But it's true that a lot of the regulations in regard to the phase trials were actually streamlined, so they were occurring concurrently rather than one following the other. It does raise the question, I think, why couldn't that be done for other medical innovation as well? And I think that is a key theme that has arisen through this whole pandemic, is how costly delay is when you're facing a crisis as consequential as this. The last time I saw the UK economy in terms of market activity alone, let alone all the costs of lost liberties and constrained lives, is losing about £6 billion per week as this pandemic rolls on. I imagine that's even higher now under the current lockdown measures. In the US, if you add up the economic welfare losses just from the market activity impact and the health impact alone, we're talking about $15 billion per week, as estimated by Donald Trump's Council of Economic Advisors. So the returns to solutions that can end this pandemic even a few weeks earlier are absolutely massive. And we can come back perhaps to the regulatory issue, but I think one of the big flaws in a lot of the advice that economists have been giving, particularly macroeconomists, is that they've kind of been focusing on this recession that's been induced as a result of the pandemic, as if it's an ordinary recession, and really advocating vast amounts of government expenditure and relief on kind of traditional marginal propensity to consume grounds, when actually diverting more resources into speeding up the availability of vaccines, even by a few weeks, would have had benefits that vastly exceeded the costs. Yeah. Now, on the regulatory side, you're right. I mean, I write about a couple of different examples of this failure to weigh up the costs and benefits of regulations in regards to testing. It's commonly acknowledged now that in the US, at least, the Food and Drug Administration here made a complete pig's ear of the availability of early diagnostic tests, Some of them were actually available for use in Sierra Leone before they were here in the United States. And the fundamental flaw from an economic perspective there was a faulty cost-benefit analysis that was being undertaken. At that time, the alternative to a slightly inaccurate test, which is what they were worried about, and so why they introduced these new hurdles for tests to be used, the alternative to a slightly faulty test that told some people that they were positive when they weren't, and some people that they were negative when they weren't, was actually having no test at all available, which of course means vast numbers of people are walking around falsely thinking that they're negative and not infected, and we're all having to live our lives as if everybody else is positive. So there's vast numbers of false positives. So at that time, the availability of any type of test, even if it wasn't the most accurate in the world, given the high prevalence of the virus out there, would have had benefits that vastly exceeded costs. And we've seen that mistake repeated again with the kind of rapid strip tests, where public health officials have failed to take into account that even though those are less sensitive in picking up the virus, they have other big advantages that, if used as part of a testing regime, can allow us to open more activities at lower risk. And we see this mistake, as I say, these faulty cost-benefit analysis from the faulty counterfactual being outlined again and again and again when it comes to medical innovation.
Yeah, so, and the obvious thing, which is why I think this is a very good point for people of a libertarian bent, is that that's very much an insight with wider applicability to scientific research in general. I mean, not just medical research, but it just happens to be the case that medical research is one area which is particularly heavily regulated. It's worth saying that with the EU, as you know, there's a bit of schadenfreude, I fear, among some circles here in the UK about the comparison between the rollout of the vaccine here and the extremely slow rollout, it has to be said, in many parts of the EU. And my own sort of impression is this is not because the EU went for a collective purchasing system. That actually probably did make sense. It's that they've been unbelievably slow and cautious in their regulatory approval process. And this seems to reflect, just as you say, completely faulty cost-benefit calculations, one kind or another. And it also, what do you think that this all shows us about the importance of the economics of innovation, you know, and how it works?
Yeah, look, I think from a regulatory perspective, the key lesson is not so much that the benefits of deregulation always exceed the costs. I mean, that would be incredibly convenient from a libertarian perspective. I think the key lesson from that observation about the regulatory mistakes is that regulations do tend to have a big downside, and that is they harm an economy's adaptiveness to new circumstances. And by precluding a lot of activity, preventing entrepreneurs from testing out new ways of doing things. In this case, you know, the absence of being able to undertake things like human challenge trials for vaccines, for example, that could have massively spread up the vaccine process. They have big costs in terms of those costs of delay that I've been talking about. So I think we shouldn't go too far. There are still incentives, even with high levels of regulation, to kind of swing for the fence and develop new products that completely circumvent the existing regulatory framework. So you see that with companies like Uber, for example, who develop new products that within them have mechanisms that kind of lead to a degree of self-regulation that means that they can completely overturn the need for the existing body of laws and rules. But I think on the margins, regulation prevents a lot of existing companies and plants and labs, in this case, from doing that tinkering that Matt Ridley says is so important to innovating and finding slightly new ways of doing things that can have big benefits relative to cost.
So let me close our part with this question. I mean, you mentioned how you thought some macroeconomists had basically missed the target, really, or got the nature of the recession that we're in at the moment wrong. And I have to say that quite a lot of economists have not done that well in terms of comment and analysis during the pandemic. Some seem to have forgotten the importance of insights like trade-offs, thinking at the margin and things of that sort, and swallowed uncritically an argument coming from governments around the world and the kind of arguments you mentioned from Andrew Cuomo. But on the other hand, there's also been a very large number of economists who seem to have taken the virus as a challenge which they just need to downplay as much as possible. So why do you think so many economists have actually struggled with this emergency?
I take a slightly different view. I'm not entirely sure I fully agree with the premise. I think relative to a lot of other professions, economists have had an okay crisis. You're right in suggesting that a lot of people have done badly. I think one big issue is the idea of kind of economists these days are a lot more specialized than perhaps they have been in the past, when a lot of them were trained primarily in price theory and had the economic theory really drummed into them. A lot of them are purer kind of empiricists that operate in much narrower silos these days. And when it comes to that, they end up kind of being quite territorial of their own pet projects. So I think that manifests itself in the macroeconomic debates, where, as I say, there's been a hell of a lot of people who have reacted to COVID by fighting the last war and acting, especially in the United States, as if this was the Great Recession. It was all primarily demand driven, and what we need is vast amounts of relief and government expenditure. But I think we've also seen it in areas to do with that relief as well. I'll give you just one quick example. Here in the United States, a lot of British people find this difficult to believe. After the first hit of the virus last spring, instituted a policy where anybody made unemployed in that period was given the ordinary unemployment benefits in their state if they were eligible for them, plus $600 per week. Now, that was an extraordinary amount of money, and one can suggest that there weren't many jobs being created then, so it might not have had as big a consequence on rehiring as you might have expected. But some jobs were being created in industries where there'd been demand shifts to home delivery and what have you, and a hell of a lot of employers were finding it very, very difficult to hire people as a result of that policy. It appeared in a lot of the Federal Reserve surveys, for example, as a big worry and concern about among producers. Now, why was that? Well, the $600 a week happens to equate with working 40 hours a week at $15 hourly wage. And I think a lot of people were implicitly fighting the battle over the correct minimum wage when it came to setting the level of unemployment insurance. So I think we've seen a lot of that. But I would say that my book mainly focuses, to the extent the examples do, on how a lack of economic reasoning has led to bad decisions, primarily by public health officials and politicians. So I'll give you just one example of that. Over here, and I believe this was the same in the UK too, Dr. Anthony Fauci and the Surgeon General Jerome Adams, early on in the crisis, were explicitly telling people not to wear face masks in the community. It wasn't just that they weren't just remaining neutral and saying wear them if you want them, but they might not do much, they might not have high efficacy. They were actually telling people not to buy them. Now, why was that? Well, on the scientific side, they seem to believe that asymptomatic transmission wasn't a big issue. And so people who had symptoms probably wouldn't be going out or would be wearing masks anyway. So it was irrelevant whether they were being worn in the community. But at an individual level, masks were, of course, a very, very low marginal cost, potentially high marginal benefit for society more generally, action that people could take. The reason that they told people explicitly not to wear them is because that they kind of considered the mask market in a very static, non-adaptive sense. They thought that if everybody went out and started demanding masks, there'd be severe prolonged shortages for existing healthcare workers who really did need them. And by giving that advice, they actually ended up slowing down not
Yeah.
just the adoption of masks, but the production of masks as well. And if they'd have done that sooner, then who knows, there's still debate around the efficacy of mask wearing in the community, particularly when you get offsetting effects like people then spending longer indoors as a result of wearing them, some risk compensation. But it seems perfectly plausible to me that they did both public health damage, but also economic damage by not facilitating that adjustment more quickly.
Yeah. Well, thanks for that. And I'll sort of move on to the questions. And thanks to everyone who's put in a question. We'll try to get through as many as we can. So one here from Elaine Sternberg. And Elaine asks, under what conditions might it be better, economically and ethically, for the vaccines to be distributed via the market rather than by government command and control? For example, if COVID were less contagious or dangerous, or if there was a surplus of the vaccine, perhaps in a category, with some of the proceeds ploughed back to fund more COVID relief. So,
well, that's a great question. I think we have seen some of the downsides of not allocating via the price mechanism, because of course, if you don't allocate via prices, you have to allocate by queuing or bureaucratic decision making. And I've actually been fortunate enough to have got 2 doses of the Moderna vaccine here, precisely because of this kind of cat-handed bureaucratic decision making in terms of vaccine allocation. Now, why is that? Well, here in DC, it was initially only healthcare workers and the over 80s who were able to obtain the vaccine. After the riots on January the 6th, I was in a supermarket in my local Safeway here, and a lot of people had cancelled their appointments or failed to show up because of the dangers of what was happening in the city. And there were surplus vaccines from open vials that people were queuing up in order to obtain. Now, I was lucky enough to obtain one of those doses and then get the second dose 4 weeks later. But one, downside of not having a more broad eligibility for those initial supplies of vaccines were some areas throwing them away. And in Florida, where you have large numbers of people who are eligible through the virtue of their demographics, massive queues of people often queuing just outside or indoors, huddled together and potentially spreading the virus. So the price mechanism doesn't have to be perfect. I think John Cochrane has written perfectly about, has written very well, on how the price mechanism would have had some big advantages in this. But it doesn't necessarily, it strikes me, have to be you have to go back to using the price mechanism at the consumer side. I think one problem that we've seen in the production of these vaccines, particularly from the EU, is that a kind of stinginess in a willingness to actually pay for the manufacture of vaccines has perhaps led to a slower rollout than we would have otherwise seen. There's all sorts of modeling that can be done on the most efficient allocation. I think Elaine's right that there will be certain circumstances under which allocating via the price mechanism would have been better. It may well have even been better to have done it in this instance, given there would have been a high, propensity for healthcare organizations and whoever to really stump up early, and that could have incentivized a greater production. That said, of course, there are kind of externalities here that you have to think about, but we've got to compare the institution where you're using the price mechanism with what we're actually seeing in this imperfect world, and not hold price allocation to a standard which we're not setting for allocation by queuing or by bureaucratic decree.
Yeah, definitely. I've got a question here from Peter Lloyd. Isn't it the case that politicians and other authorities completely ignored economics in their reactions to the pandemic? This is reflected, he says, in the absence of a formal impact assessment and a deferral to, quote, the science, unquote, as though it was fully understood by a few experts and politicians shouldn't take anything else into account or use their own judgment. So is it the case that economics has simply been completely ignored?
I wouldn't go as far as saying it was completely ignored. I think the danger in that opening spring was that there was a rapidly escalating difficult situation, and there was a strong possibility, given what we'd already seen happen in Italy, for example, that if left unmitigated, or at least unsuppressed, that there would be severe congestion externalities in hospitals, with hospitals being overrun with cases. So I think the underlying economics there, I agree that there might not necessarily have been impact assessments done at the time, but time was of the essence. And I think policymakers were worried about a tail risk, which was this severe overrunning of healthcare capacity and mass death. And one can understand, even if they thought that was only a relatively low probability, that they were worried about that eventuality, and so took a precaution. I think where Peter is right, however, is that over time, particularly post those initial lockdowns, it's much more difficult to justify not having undertaken a more rigorous economic analysis of future lockdowns, particularly given that kind of summer reprieve. I think policymakers should have been taking whatever means possible to try and achieve some of the objectives of suppressing the virus at the lowest cost possible. And I think rather than doing that, I haven't followed the UK debate as closely as I have in the US, but it seems to me that the UK government instead engaged in a degree of fine tuning, where they were attempting to balance the public health and market economy considerations. And rather than leading to a situation where they got bits of both, they ended up with quite a severe overall economic downturn, perhaps not quite as bad as the headline statistics suggest, but still one of the worst in the world, and also very high deaths as well. Kind of reminds me of the 1960s and 1970s, where Keynesian thinkers were, implying, and politicians were trying to achieve trade-offs in inflation and unemployment, and ended up with both unemployment and inflation.
Yes, indeed, worst of both worlds. So Sophie Demartiak asks, as part of the younger generation, I've been warned about having to pay for the costs of COVID in the future. How bleak is the situation for young people, and what can be done to make their situation better?
Well, that's a great question, Sophie. I'm not actually that pessimistic about the near-term economic consequences of this. There's obviously a lot that we don't know looking into the future, and I think one big unknown that perhaps hasn't been discussed as much is what kind of impact this crisis will have in terms of scarring on the behavior of entrepreneurs. I doubt that many people who invested and built their businesses ever perceived there was a situation where the government could have shut their business for much of a year on public health grounds. So I think in particular sectors, you're going to see large degrees of divestment. Now, whether that has a general kind of scarring impact on entrepreneurial activity or innovation, inclusive of the fact that people haven't been able to get together to generate new ideas in many companies as easily, I don't yet know. But I think there are reasons to be optimistic generally about the potential rebound from this. Unlike an emergency situation like a war, we haven't had much in the way of physical capital destruction that has got to be rebuilt. Obviously, there's been a severe loss of life, but it has tended to be people in the later years of their lives. And I doubt that this crisis has done much to dampen human capital as well in the longer term. Notwithstanding, the closure of schools for part of 1 year. But I don't see any inherent reason why we shouldn't expect the economy to by and large return to the growth path that we were on prior to the crisis when this is all over. Of course, to get there, we need the vaccine to be rolled out as quickly as possible, and to hope that there's no vaccine resistant mutations. But provided we can do that fairly quickly, I think you will see a robust bounce back. I don't think it will be back to the future of where we would have been had the crisis ever hit, but I expect the rebounds to be pretty strong. And I think there will be a pent-up demand among young people to go out and make the most of the next few years, having had their opportunities curtailed through this.
Indeed. I mean, we saw precisely that in the 1920s in the aftermath of the great Spanish flu pandemic. That was one of the reasons why there was such a kind of wild party scene and all that, the rest of that in places like Weimar, Berlin. I would push back a bit more though, because I think what Sophie was also talking about was the debt overhang, because governments have, of course, borrowed a huge amount of money. So what view do you take of, any problems that might cause in the future, or are you relatively relaxed about that situation at the moment?
Well, I've debated this with Philip Booth a couple of times via email, and I'm much less worried about the uplift in debt than perhaps some other free market economists. I think that these completely unforeseen exogenous shocks are exactly the type of event where uh, you should let borrowing kind of cushion the downturn, and you shouldn't, in the near term, seek to raise taxes to pay down that debt sooner rather than later. I think this is something that we should spread over a generation. It's an event that has hit everybody in different ways through this crisis. And I think some really severe near-term fiscal consolidation would actually be worse in many ways for the younger generation in terms of higher taxes diminishing the economic growth prospects of the economy in the near term. And just to put it into a bit of context, I don't have the exact figures with me, but even though when you look at it in isolation, the uplift in the level of debt as a result of this crisis is significant. It is very, very significant. In the grand scheme of things, given the contingent liabilities that most Western economies face through promises that they've made to elderly people in the form of pensions and healthcare expenditure and social care expenditure, I wouldn't say this is a drop in the ocean. It's certainly not that. But the longer term fiscal challenge is still about reforming those programs and dealing with the demographics of an aging population rather than this one-off hit to debt levels, which at the moment, we're market economists. We believe in market signals. At the moment, markets don't appear to be screaming that this one-time debt uplift is a massive problem. And we don't know, of course, yet what the longer term impacts of this crisis will be on the structural deficit. If it does leave a big structural deficit afterwards, if our productive potential as an economy is impaired, then of course there will need to be consolidation further down the line. But it seems to me severely premature to talk about big tax rises at the moment.
Yeah, we've got a question here from one of my colleagues, Alex Lee. So as he says here, he's aware he doesn't qualify for the giveaway. Do you think there have been any correlations between having a liberal market economy and certain sort of traits about how they've been impacted by COVID? In other words, is there a correlation between having a more open economy and doing relatively better, having a closed economy doing relatively worse, or is there no real correlation of any kind there?
I haven't undertaken that particular correlation. My guess is that there wouldn't be much of a correlation, or there might even be the kind of adverse correlation from our perspective, but I'd need to go and look at that more closely. I ran a whole bunch of correlations at the tail end of last year, which would need to be updated now, given the dramatic changes we've seen in the pandemic over the past 3 months. But pretty much every explanation that is bandied around out there about underlying structural factors for why some countries have done well and others not so well doesn't really stand the cross-country correlational test. You hear a lot of libertarians even who are kind of on the more classical liberal end talking about state capacity, for example, and the importance of having good state capacity. But actually, if you take some of the pre-pandemic measures of state capacity and map that against deaths, you really have to torture the data by excluding certain countries before you get the relationship that an increase in state capacity or the government effectiveness or government quality leads to a better performance in regards COVID-19. So with a lot of these correlations and theses that are put out, you end up with a bit of a tautology. I've joked about this with the economist Tyler Cowen, because he's a big proponent of state capacity libertarianism, and he highlights the failure to deal with the pandemic as an example of a lack of state capacity. But I say to him, well, you can't on the one hand say, what's the reason we've done badly with this pandemic? Lack of state capacity. How can we tell whether we have good state capacity performance with the pandemic? That is a complete tautology. So, I haven't been able to find any discernible correlation from factors that I've looked at, and that's ranged from kind of inequality. You hear a lot about state capacity, government effectiveness measures, pre-pandemic estimates of pandemic preparedness. None of these things appear to correlate with a country's performance. I think the one thing that does seem to have been a factor in East Asia is previous scares or worries about SARS or MERS and other infectious diseases, which does actually then raise the question, why were Western governments so incompetent in terms of internalizing some of the lessons that were learned from other countries? Why does there appear to be not a non-existent feedback mechanism from other countries? I think this pandemic has been very parochial in that regard.
Yeah, I mean, it is striking actually that, as you say, that what is the lack of correlation. There don't appear to be any sort of meaningful correlations. I think it does. I think you have a whole chapter on this, of course. It does cause us to be really, really careful about these cross-country comparisons. You have, as I say, you have a whole bit on that. So Jethro Elsden says, are there any free market solutions to preventing future pandemics? Or is it just a case that it's an area where only government action will be effective? Or indeed, and I would add this myself, there's very hard to do anything to prevent it, really.
Well, it's difficult to think of obvious free market solutions to prevent pandemics from the risk of pandemics ever arising. I mean, you can be a free marketeer and worry about externalities. You might think about imposing severe restrictions on attendance at wet markets. Could be one thing, but that's obviously a very interventionist solution. I do think there are key lessons that we've learned from this crisis, which could help further a kind of libertarian agenda and help in future pandemics. So one thing is to reassess the regulations that exist on medical innovations, because it's now pretty obvious that if we had widespread availability of testing very early, or if we had widespread availability of a vaccine far sooner, then we could have severely dented the combined economic and health costs of this pandemic. I think that trying to deal through trade agreements or perhaps multilateral negotiations to preclude export controls being imposed on medicines and manufactured goods, ventilators and the like, could be another means by which we could make the whole world more resilient to a pandemic such as this in future. I think when it comes to some of the kind of lockdown measures, it's more difficult to think of free market solutions. That said, I think the trade-offs that we hear about, I don't always think are the right ones to consider. South Korea, for example, took a very, very different route than most Western economies. It's had a fairly open degree of market activity over the past year. And has done fairly well. It's had some struggles at times, but fairly well in dealing with the public health consequences of the pandemic. But there, the trade-off came along the margin of civil liberties. There were pretty extensive information sharing and gathering on behalf of public health officials to track where the virus was occurring and to contact trace people, including things like credit card information, use of private CCTV footage and the like, and putting out sometimes for individual cases such an extent of information that individuals might even be able to identify the specific person who was infected. Now, I know a lot of libertarians would implicitly balk at that, but then you have to ask yourself, is that rigidity in terms of maintaining the civil liberties worth the economic and health costs that we faced over the last year? So I guess my short answer to after that ramble is to say I think there are big things that we could do on the margin in regards medical innovation. But when it comes to the specific things that could have helped in this crisis, there are very, very thorny trade-offs that means quite often, even as libertarians, we'd have to give up significant amounts in order to achieve better outcomes.
Yeah, I agree. So a question here from Syed Kamal. So Syed asks, are we being a bit unfair on policymakers given the imperfect knowledge of humans seeking to understand a complex situation and complex systems? Aren't the mistakes we're all seeing all part of the Hayekian process of discovery?
I thought Mark Pennington's lecture that he gave to the IA on this was really instructive, and that's one of the reasons that I wouldn't attack policymakers for what some regard as the knee-jerk reaction of shutting down as much of the economy as possible last spring. I think given the uncertainties that we faced at the time and given observation of what was happening in Italy, I can understand the precaution that was taken. I think what we've seen since then, though, is the importance, I think, as Saeed says, of a lack of a kind of feedback mechanism that gives policymakers information on what works and what doesn't. We haven't seen enough innovation, I don't believe, in trying to identify which particular aspects of quite crude blanket lockdown regulations work and which don't. And I do think you can criticize policymakers of the degree of hubris that they've shown at times in believing that they could control the virus. I believe it was a massive mistake by the UK government in the summer to really lean into the economic reopening by subsidizing indoor dining and then reopening schools and universities without some sort of rapid testing regime in place to try and prevent escalating caseloads as the prevalence of the virus increased as a result of those policies. So I agree with you, we have to cut them a degree of slack, but over time, I think we have seen a degree of hubris from policymakers in thinking that they could actively fine-tune a balance between public health and market activity, and I think that confidence was always unwarranted, and in many ways would have been better if they'd have kept a kind of stable degree of regulations and restrictions, such that people could innovate around them. Now, what the precise level of those restrictions and makeup of those restrictions would have been is obviously a very, very difficult question. But I think the kind of on-off fine-tuning has proven quite disastrous, both in the UK and in certain states here, like Florida, California, and the like.
Yeah, indeed. Well, my thanks to all the people who put in questions. Apologies to those of you who we've not been able to reach. A question there from Eamon Buffalo, which I thought was rather interesting, and another one from Peter Lloyd. But I'm afraid we are pressed for time here. And so I'd like to thank everyone in the audience for their participation. Hope you've enjoyed this. And also, in particular, I'd like to thank the book club members and the donors who support this cause and make these kind of events possible. And it remains me to announce the winner of the giveaway, and the prize goes to Sophie Demasiak, whose question, which I'll read out again, is, as part of the younger generation, I've been warned about having to pay for the costs of COVID in the future and how bleak is the situation. So congratulations to Sophie for having won the giveaway prize there. So please do consider supporting Ryan by purchasing a copy of his book when it's released, and a link to where the book can be bought is in the chat. So if you scroll back up in the chat, you should be able to find a link to be able to do that. So please do consider supporting Ryan and his publisher as well, the Cato Institute, through doing this. So also some upcoming events. Tomorrow at 6 p.m, we'll be hosting the Right Honourable David Davies MP for our latest episode of our In Conversation series with senior figures across public life. And chairing this will be the IEA's Director General, Mark Littlewood. The IEA's weekly Live with Littlewood show will unfortunately be taking a break this week, but please do visit the channel to check out all our latest content. And to that end, I'd highly recommend you visit, if you haven't already done so, our Economics 101 series of economic explainers, featuring myself amongst others. This education resource is provided to the public for free, thanks to the generosity of the Munnery Trust. Thousands of students here in the UK and indeed the world are currently studying from home due to school closures. This free offering to students and teachers will not only provide an added resource at crucial time, but hopefully inspire them to go watch and read the wider array of materials that the IEA has got to offer. So I do recommend that you have a look at that. That's on our YouTube channel. Whilst you're on our YouTube page, please do subscribe to our channel IEA London and be sure to hit the bell icon, because that means you'll get notified whenever we release a new video. Do follow our podcast at ieapodcast.podbean.com. And finally, visit our website at www.iea.org.uk, where you can help us keep our content going by providing us with a contribution. And a donation, no matter how modest, would be a huge help, and it would be deeply appreciated by all of us here at the Institute. So I hope you've enjoyed this evening. Look forward to seeing you again at future events. Bye now.